Hello and welcome to Premier Dermatology. I'm Dr. Missy Clifton and today we're going to be talking to you about CoolSculpting. CoolSculpting is one of our most popular procedures. We've been actually doing this procedure since 2011. So we have lots and lots of experience with it and we get fantastic results with it. CoolSculpting is actually used to eliminate stubborn areas of unwanted fat. It's really for people who have areas that no matter how much they work out, even if they're at their goal weight, they just can't get rid of these stubborn areas. The lower abdomen, the upper abdomen, the flanks, even back of the arms and other areas can be treated with this device. We get fantastic results and it's virtually pain-free. As soon as you get up from the table, you can go right back to your usual activities without any problems at all. So let me introduce you to who is in the room with me today. We have our beautiful patient, Christy. We are going to be treating her lower abdomen today. And then we have my dear friend, Lindsay. Lindsay is a master CoolSculptor, which means that she has literally been to CoolSculpting University, not once, but three times, which means that she's been chosen by the Allergan company who makes this device to come and really share her expertise with others and learn really advanced techniques in using this device. Lindsay, welcome.
Thank you very much. I'm excited.
So Lindsay, let's go ahead and get ready, get Christy prepped.
Absolutely.
And I'll kind of talk to you guys about the procedure as we go. So the first step, Lindsay is actually going to be cleaning off Christy's skin. This just makes sure that her skin is very, very clean. There's no extra oils or anything on the skin so that the applicator can really affix itself firmly to the skin area. After that, she's going to be putting on this really interesting kind of gooey gel pad. And the gel pad is really imperative for this treatment to work well. Because what it does is it actually puts a nice layer over the surface of the skin so that, one, the applicator can really affix itself really smoothly and evenly. And Lindsay puts it on to make sure that there's no bubbles or any areas where the skin's not going to be in good contact with the applicator. So it's really just a protective medium that helps the applicator to really get a good suction hold on the area that we're treating. Now she's just doing her settings, getting the device all ready to go. This is the lower abdomen Cool Advantage Plus. It's one of the most popular applicators we use because this area is a really stubborn area for a lot of people. So Lindsay's going to go ahead and apply the applicator to this area. You can see it it just kind of sucks the skin and that fatty tissue right up into the applicator. So it's a really neat little device. So then Lindsay just stabilizes the arm and makes sure that it's really comfortable for Christy. And Christy's going to be here for about 45 minutes with this applicator, correct?
Yes.
Okay. Christy's nice and comfy. She's just relaxed over there. The device is cooling the fat to negative 11 degrees Celsius. Is that correct?
That is correct. That's the target temperature where it's going to cause damage to those fat cells so that your body can then start to process and break those down.
So during the procedure, the skin is, as I said, kind of pulled up into the applicator, as is the fat. There are sensors in the little cup that are actually testing the temperature, the skin temperature, as well as the fat temperature. So you're actually getting the cells of the fat down to negative 11 degrees Celsius. But the skin is being protected so that there's no damage to the skin or the muscles or any of the other tissue there. So the fascinating thing is once the fat cells get to that temperature, what happens?
Yeah, so the fat cells are going to die off with this treatment within the next 3 days. Your body's going to send in enzymes to break down these fat cells processed as waste and eliminated from the body.
Excellent. So as this is happening, will Christy feel a lot of discomfort or will there be any pain involved as the fat cells are getting broken down?
Yeah, that's a good question. Christy will be able to return to all normal activities. She can work out, she can work, she can do all her normal activities. She may have a little bit of minor soreness to the area, a little bit of swelling, possible of some bruising, but this should not stop her from her normal activities.
So now that the device has finished its cycle, Lindsay's going to be removing it, and you can see the fat actually looks like a little frozen kind of chunk of butter there, which is exactly what we expect fat to look like when it gets frozen. And the next step is to manually break down as much of that damaged fat tissue as we can. So we're going to be using our Z-Wave to actually manually break down that fat.
You doing okay? Just correcting the stains and burn. She's so tough. Look at that great treatment. Looks good. Right.
So Christy, how are you feeling?
Great.
Good, perfect, excellent, excellent. So Lindsay, you discussed that in about 4 weeks, Christy will need to come back and have her second treatment in this area.
That is correct. About 30 days, I'm going to want to see Christy back for her second treatment. That way we make sure all those fat cells have been eliminated with that first treatment, which is going to be about 20 to 30% of those fat cells. Then we're going to do that second treatment, which is going to get 20 to 30% more fat cells.
Fantastic. And then when can Christy really feel confident that she's seeing the best results from the treatment?
With CoolSculpting, your best results are going to be in about 3 months. We'll bring you back in for a follow-up and take your follow-up pictures at that time.
So you just did the Z-Wave to really enhance the damage to those fat cells that were frozen. It's basically, since those fat cells have ice crystals in them, that Z-Wave, that pressure is actually piercing those crystals through the fat cell and actually causing more fat cell death than you can actually get with just the CoolSculpting alone. So it's a really interesting addition to the treatment, and that's no extra charge, correct?
Right, correct. That's part of our treatment plan that we do here at Premier.
Fantastic. Are there things that you recommend that Christy do at home? Should she massage, drink lots of water? Are there anything that could really help her results?
Yeah, I always recommend drinking lots of water. It's good for the health of our body and functions of the body. So I tell people all normal activities, including exercise and drinking lots of water.
Excellent. Thank you, Lindsay.
Thank you.
Thank you, Christy.